Thanks, Mia. I would like now to welcome to the stage Aamer Ghaffar, the CEO and co-founder of mHealthCoach, to present Flornce.
Hi, everybody. My name is Aamer Ghaffar. I am representing the team mHealthCoach. We are a Chicago-based organization which has a core competency in patient adherence programs. At mHealthCoach, we try to take a 360-degree approach for patient engagement, adherence, and compliance solution. I must take a moment and say special thanks to Health 2.0 and HHS for unlocking the data and providing us a platform that has been instrumental in the continued evolution of our product. We are the proud winners of innovation challenges of Walgreens, Novartis, and ONC in the last year. Our solution is trademarked Flornce, which is a cardiac recovery kit to reduce readmissions and promote speedy recovery. It consists of a hospital discharge process with inpatient patient education that is delivered to the patient at the bedside, and a patient recovery module that consists of a home kit including devices and an e-reader tablet form factor mobile device, as well as a patient adherence program for continued recovery after the first 90 days or 16 weeks of cardiac rehab. The inpatient module uses more than 12 different data APIs provided by HHS and CMS, and is the result of the 10 most common questions a cardiac patients ask at the time of discharge. And all of this is integrated, aggregated, and made easily available through a patient-centric search engine. So with that, I'll go to my device right here. And it's in the form of a tablet that is delivered right at the patient bedside. It includes video educational content as well as medication literacy to educate the patient about the known side effects they can expect in their recovery post-discharge. The care resources are exposed through the patient-centric search engine. That includes symptoms and conditions, clinical trials, local resources, community resources, and a list of all the primary care physicians from the inclusion of the NPI database of CMS. Brian, who is our SUDA patient, can easily come in here and scroll and look at all the clinical trials that may be available in the area that he lives in. All the primary care physicians. One of the 4 most common questions asked from primary care physicians are their gender, office hours, address for easy accessibility, and a contact number. And we're providing all of that information right here. As well as to get more credibility for Brian of this product, we have integrated Twitter and YouTube so they can go and find out what, if any, buzz is going on these topics. If Brian has been prescribed home care services, home health services, we have included all the home health agencies and cardiac rehab facilities in the city where Brian resides. He can go in there and scroll down and see what are the home health agencies, what services they provide, for example, nursing care, speech pathology services, or occupational therapy services. Because of the large amount of this data set, we have provided easy filtering. Since Brian may only be interested in agencies which are 5-star rated versus the kind of services they provide. And we have also provided rating services for Brian, which is from the inclusion of HCPU Net database, which my understanding is a combination of HCAP scores and patient-reported outcomes. So Brian can have a much more informed decision before he leaves the hospital. Besides the care resources, there's a risk profiler engine, another method of educating Brian about how taking an action like quit smoking, being on an aspirin anticoagulant therapy can reduce his risk of being from a high-risk patient to a medium-risk patient. Besides the risk profiler engine, we have a teach-back mechanism. Not only does this provide the discharge nurse that Brian has completed his set number of hours of education, but also works as a measuring tool for the success of this program. So on the day of the discharge, the nurse using the discharge module within our kit is able to go and integrate the CCD document, the continuum of care document for the current stay of Brian. We have integrated with the major EMR systems out there and continuously working with integrating with the rest of them. But what we do is we add, on top of the CCD, identification of care team, which is an important factor, any devices that may have been implanted in Brian during this MI, post-MI or CABG stay, appointments, primary care physician appointments and cardiac tech appointments, medication reconciliation, and a very comprehensive detailed discharge summary that includes not only a checklist for the practitioner, but also reiterating the pledge that Brian took in the last 2 days of his patient education. So what we're trying to do is we're really trying to get the patient engaged. In the last 3.5 years of our patient adherence programs, the patient engagement has been really lacking. We can do a media blitz, a marketing campaign, get a lot of patients on board, but we're not able to sustain them post 8 weeks or 9 weeks. So we're like, okay, what is the main problem that causes people to not get engaged? And that was, smartphones, yes, but the population that really needs help, they don't have smartphones. So we have solutions for feature phones as well, but we really came up with a device, which for anybody who can see is a tablet form factor, an e-reader, which is all totally loaded before even Brian gets to his home and is part of his discharge kit. It's got the educational pledge that Brian took. It's got all the information about his physical activity, as soon as this loads up, his physical activity, his symptoms and conditions, diet and nutrition information, tips to reduce stress, and as well as any kind of monitoring that he needs. If he was prescribed to monitor his weight, he can easily come in here and input his weight. If automatic monitoring is desired, that we are integrating with blood pressure cuff, heart rate, physical activity, and weighing scales. We have Bluetooth, and we just started working on the protocol ANT to even take out the pairing of the devices factor out of it. This tool also has a very robust two-way secure messaging reminder server where Brian is notified about his medication intake times, his upcoming appointments, any vitals that may be missing. And all of this information is available back at the hospital to a cardiology tech where they can easily see the blood pressure, oximeter, heart rate, and all the vitals that are required for a successful therapy of Brian. And they can drill down in the details and maybe come up with some recommendations that I see that you are doing fine on your physical activity, but your weight is all over the place. That indicates you're not following the low sodium prescribed diet. So we really hope that bringing up an innovative solution like this, educating the patient and making it easily accessible, we are able to make an effect into the patient engagement program and reduce readmissions for the provider facilities for them to pay for this and make it free for Brian. Thank you so much for your attention. It's been a pleasure being here.